Hi guys, I'm Dr. Brian Edwards, your local Coral Springs area chiropractor, and I'm here with Sandy, and she came into the office because she's complaining of a little tension in her neck and upper back, as well as some low back pain. She's recently getting over some cold and some allergies, so she's been feeling a little faint, and because she's been so congested with a lot of stuff going on in her chest and coughing a lot, so she's obviously got some tension up in here. When you cough a lot, those ribs, everything kind of flails out when you do that violent coughing. It's a violent act that can cause a lot of tension in here, and she also has some low back pain. She's been a patient in the past with a history of a couple car accidents here and there, so we're just here to give her a little tune-up and share this with you. So if I could have you lay face down for me, please, Sandy. Negative field on the right, just a leg check. So she's very tender to here. And how about on this side?
It's more on the other side.
More on this side, yeah. How about when I press in here?
Oh, yeah.
Any pain, numbness, tingling going down the legs, anything like that?
No.
So she's got a little inflammation around the SI joint. That's where the sacrum and the ilium attach together. And it's a little swollen and boggy versus here.
Oh.
And she's just...
That side.
Usually after you have a cold and you're feeling like crap, everything is just very achy and sore. So we're going to do what we can to get her feeling better and give a little boost to her immune system. Take a deep breath in for me and blow it all the way out. Okay. So, just relax your body. You're going to feel this table drop under you. Cross this leg over this one like that. And we're just trying to open up and mobilize this SI joint. And this table allows me to mobilize her pelvis in a specific manner that I can't typically do when I have patients lying on their side. Some of you may have seen other videos I've done where I have them lie on their side. So this will help to alleviate some of this tension here. That helped balance out things pretty nicely. Now you might be thinking, why does he keep looking at her feet? Does he have some sort of foot fetish or something? And the reason I look at the feet is, in chiropractic school we were taught that the leg check of the feet are the window to the spine. And you stand on the floor, that is your foundation with earth. And when you have tight hamstrings or various muscles that are tight, they can pull and torque on the pelvis and cause certain leg length patterns. And that's not the only thing we do. We do palpation, where we're feeling around and checking movement of a joint. So it's just one tool to aid me, just in case any of you didn't know what a leg check was. But they're pretty common with most chiropractors. Some doctors use other techniques. Okay, now we're going to try this area again because this whole area is pretty stiff. Take a deep breath in for me and blow it all the way out. There we go. Is it sore in here?
Yeah.
That's all right, very. Take a deep breath in, blow it all the way out. There you go. We'll come back to that. I might have to flip you around your back. So she has a lot of tension in her neck and upper back. It's very tender. You can hear her wincing here a little bit. I'm trying not to torture her too much, but she has some trigger points. And this is typical with anybody whose head sits or translates forward a little bit, or someone has been coughing a lot along the rib line. The rib heads, they're very tender here. So I'm just trying to work these muscles a little bit and just try and get them to release so that the adjustment goes a little easier. So we don't want to torture her too much today. Most times a chiropractic adjustment is very comfortable. Other times it can be you can be a little sore. Flip over on your back, please. But at this office, I try and be as gentle as possible. Cross this arm here, cross here. Take a deep breath in and blow it all the way out. Relax your body. Okay. Relax your arms. Going very easy with Sandy because she was in a car accident last year. Her neck has never been the same. So we're just doing some light gliding motions here, just trying to passively get some movement in her neck, and just relax your head as best you can. Now we're just going to try and make you a little taller today and just stretch you. Doing okay?
Oh yeah, that's wonderful.
Okay. What we're doing is we're opening up the joints a little bit in her neck. Sometimes we get a little release in the joints by decompressing the neck a bit.
Oh, that feels good.
And now we're just stretching out the muscles. Just some basic manual therapy for the neck. I'll slide down a little bit. Good, right there. Okay. So we're just going to be pushing Sandy's head back a little bit, trying to mirror image or create more of a upright, or restore the curve that's in her neck, or that should be in her neck that's not there now. Just trying to retrain some posture receptors that are in her neck, and obviously I'll instruct her on some exercises to do at home. Okay, go ahead and flip over on your stomach. Now this is just something I use on patients to help get a little blood flow and relax the muscles a bit. I also use it to wax my car sometimes. It's
It feels good. Oh.
It's great at helping to relieve some tension in the neck and upper back. And most patients like it. It feels good.
I love it.
Sandy also comes in at times for acupuncture. We haven't filmed any acupuncture videos yet. I don't want to bore you too much with just watching someone get some needles stuck in them, but that's a relatively non-painful experience as well. It feels like a mosquito bite. If you were to describe it, sometimes you don't even feel
No.
the pain at all. Sandy says she doesn't feel any pain when she has it done, but that helps to relax the body, and she got a little bit of both. She got the real treatment today. So we just completed Sandy's treatment. She got a little manual therapy, just some muscle work and a chiropractic adjustment. I didn't want to beat her up too much today because she's very tight, and we're just slowly working our way into it, but we'll get her where she needs to be soon. So with that being said, I'm Dr. Brian Everett, your local Coral Springs area chiropractor, saying have a great day.